You may initially experience short, mild attacks, but trigeminal neuralgia can progress and cause longer, more frequent bouts of searing pain. Trigeminal neuralgia affects women more often than men, and it is more likely to occur in people who are older than 50. Because of the variety of treatment options available, having trigeminal neuralgia does not necessarily mean you are doomed to a life of pain. Doctors usually can effectively manage trigeminal neuralgia with medications, injections, or surgery. Now let me tell you symptoms. And trigeminal neuralgia symptoms may include one or more of these patterns, which I am going to tell you now. Episodes of severe shooting or jabbing pain that may feel like an electric shock. Spontaneous attacks of pain or attacks triggered by things such as touching the face, chewing, speaking, or brushing teeth. Bouts of pain lasting from a few seconds to several minutes. Episodes of several attacks lasting days, weeks, months, or longer. Some people have periods when they experience no pain. Constant aching, burning feeling that may occur before it evolves into the spasm-like pain after trigeminal neuralgia. Pain in areas supplied by the trigeminal nerve, including the cheek, jaw, teeth, gums, lips, or less often the eye and forehead. Pain affecting one side of the face at a time, though may rarely affect both sides of the face. Pain focused in one spot or spread in a wider pattern. Attacks that become more frequent and intense over time. If you experience facial pains, particularly prolonged or recurring pain or pain unrelieved by over-the-counter pain relievers, you should see your doctor. Now let me tell you the causes. And trigeminal neuralgia, which is also called tic douloureux, the trigeminal nerve's function is disrupted. Usually the problem is contact between a normal blood vessels, in this case an artery or a vein, and the trigeminal nerve at the base of your brain. This contact puts pressure on the nerve and causes it to malfunction. Trigeminal neuralgia can occur as a result of aging, or it can be related to multiple sclerosis or a similar disorder that damages the myelin sheath protecting certain nerves. Trigeminal neuralgia can also be caused by a tumor compressing the trigeminal nerve. Some people may experience trigeminal neuralgia due to a brain lesion or other abnormalities. In other cases, surgical injuries, stroke, or facial trauma may be responsible for trigeminal neuralgia. Now let me tell you some of the triggering factors. There are a variety of triggers which may set off the pain of trigeminal neuralgia, which include shaving, touching your face, eating, drinking, brushing your teeth, talking, putting on makeup, encountering a breeze, smiling, and washing your face. So these are the triggering factors. Now let me tell you the diagnosis of trigeminal neuralgia. When patients come to us, we diagnose trigeminal neuralgia mainly based on your description of the pain, including type, that is, pain related to trigeminal neuralgia is sudden, shock-like, and brief. Location, the parts of your face that are affected by pain will tell your doctor if the trigeminal nerve is involved. Triggers. Trigeminal neuralgia related pain usually is brought on by slight stimulation of your cheeks, such as from eating, talking, or even encountering a cool breeze. Your doctor may conduct many tests to diagnose trigeminal neuralgia and determine underlying causes of your condition. When patients come to us, when we ask their history, most of the patient tell about their symptoms, then we do some examination and we usually determine the diagnosis of trigeminal neuralgia. But also we may order some tests, and also we can do neurological examination. Which is touching and examining parts of your face can help your doctor determine exactly where the pain is occurring, and if you appear to have trigeminal neuralgia, which branches of the trigeminal nerve may be affected. Reflex tests also can help your doctor determine if your symptoms are caused by a compressed nerve or another condition. Then we may order magnetic resonance imaging (MRI). Your doctor may order an MRI scan of your head to determine if multiple sclerosis or a tumor is causing trigeminal neuralgia. In some cases, your doctor may inject a dye into a blood vessel to view the arteries and veins and highlights blood flow. That is known as magnetic resonance angiogram (MRA). Facial pain may be caused by many different conditions, so an accurate diagnosis is important. Your doctor may order additional tests to rule out other conditions. Now, coming to the treatment. Trigeminal neuralgia treatment usually starts with medication, and some people do not need any additional treatment. However, over time, some people with the condition may stop responding to medication, or they may experience unpleasant side effects. For those people, injections or surgery provide other trigeminal neuralgia treatment options. If your condition is due to another cause, such as multiple sclerosis, your doctor will treat the underlying condition. Now, coming to the medication. To treat trigeminal neuralgia, your doctor usually will prescribe medication to lessen or block the pain signals sent to your brain. The first treatment option, which is widely used, is anticonvulsants. Doctor usually prescribes carbamazepine, and that comes with the name of tegretol, carbatrol, and others for that trigeminal neuralgia, and it's been shown to be very effective in treating the condition. Other anticonvulsant drugs that may be used to treat trigeminal neuralgia include oxcarbazepine, which comes with the name of trileptal, lamotrigine, and phenytoin. Other drugs including clonazepam and gabapentin, which comes with the name of Neurontin, also may be used. If the anticonvulsants you are using begins to lose effectiveness, your doctor may increase the dose or switch to another type. Side effects of anticonvulsants may include dizziness, confusion, drowsiness, and nausea. Also, carbamazepine can trigger a serious drug reaction in some people, mainly those of Asian descent, so genetic testing may be recommended before you start carbamazepine. Other treatment option is antispasmodic agents, muscle relaxing agents such as baclofen, that come with the name of gabapentin, may be used alone or in combination with carbamazepine. Side effects may include confusion, nausea, and drowsiness. Botox injections. Small studies have shown that Botox injection may reduce pain from trigeminal neuralgia in people who are no longer helped by medications. However, more research needs to be done before this treatment is widely used for this condition. Now let me tell you about surgical treatment options. These include microvascular decompression. This procedure involves relocating or removing blood vessels that are in contact with the trigeminal root to stop the nerve from malfunctioning. During microvascular decompression, your doctor makes an incision behind the ear on the side of your pain. Then, through a small hole in your skull, your surgeon removes any arteries that are in contact with the trigeminal neuralgia, that are in contact with the trigeminal nerve, away from the nerve, and place a soft cushion between the nerve and the arteries. If a vein is compressing the nerve, your surgeon may remove it. Doctor may also cut part of the trigeminal nerve, that is known as neurectomy. During this procedure, if arteries are not pressing on the nerve. In this microvascular decompression, if any artery is pressing your nerve, then the surgeon places a cushion between the artery and nerve so that it does not compress. Or if the vein is compressing the nerve, then vein can be removed. Or if it is found that an artery is not compressing, then the doctor may cut part of the trigeminal nerve, that is known as neurectomy. So these are the options in microvascular decompression. Microvascular decompression can successfully eliminate or reduce pain most of the time, but pain can recur in some people. Microvascular decompression has some risk, including decreased hearing, facial weakness, facial numbness, a stroke, or other complications. Most people who have this procedure have no facial numbness afterward. Then there is another treatment option, which is known as brain stereotactic radiosurgery, also known as gamma knife. In this procedure, a surgeon directs a focused dose of radiation to the root of your trigeminal nerve. This procedure uses radiation to damage the trigeminal nerve and reduces or eliminates pain. Relief occurs gradually and may take up to a month. Brain stereotactic radiosurgery is successful in eliminating pain for the majority of the people. If pain recurs, the procedure can be repeated. Facial numbness can be a side effect. Other procedures may be used to treat trigeminal neuralgia, such as rhizotomy. In rhizotomy, your surgeon destroys nerve fiber to reduce pain, and this causes some facial numbness. There are types of rhizotomy, which I should tell you. First is glycerol injection. During this procedure, your doctor inserts a needle through your face and into an opening in the base of your skull. Your doctor guides the needle into the trigeminal cistern, which is a small sac of spinal fluid that surrounds the trigeminal nerve ganglion, where the trigeminal nerve divides into three branches and part of its root. Then your doctor will inject a small amount of sterile glycerol, which damages the trigeminal nerve and block pain signals. This procedure often relieves pain. However, some people have a later recurrence of pain and may experience facial numbness or tingling. Another option is balloon compression. In balloon compression, your doctor inserts a hollow needle through your face and guides it to the part of your trigeminal nerve that goes through the base of your skull. Then your doctor threads the thin flexible tube, which is catheter, with a balloon on the end through the needle. Your doctor inflates the balloon with enough pressure to damage the trigeminal nerve and block pain signals. Balloon compression successfully controls pain in most people, at least for a period of time. Most people undergoing this procedure experience at least some transient facial numbness. Then another treatment option is radiofrequency thermal lesioning. This procedure selectively destroys nerve fibers associated with pain. While you are sedated, your surgeon inserts a hollow needle through your face and guides it to a part of the trigeminal nerve that goes through an opening at the base of your skull. Once the needle is positioned, your surgeon will briefly wake you from sedation. Your surgeon inserts an electrode through the needle and sends a mild electrical current through the tip of the electrode. You will be asked to indicate when and where you feel tingling. When your neurosurgeon locates the part of the nerve involved in your pain, you are returned to station. Then the electrode is heated until it damages the nerve fiber, creating an area of injury, that is lesion. If your pain is not eliminated, your doctor may create additional lesions. Radiofrequency thermal lesioning usually results in some temporary facial numbness after the procedure. Pain may return after 3 to 4 years. Now I should tell you about some alternative medicine. Alternative treatments of trigeminal neuralgia generally have not been as well studied as medication or surgical procedure. So there is often little evidence to support their use. So you should remember it, because on internet there are so many videos of alternate treatments for this, but none of them have been proven so far. So it's better to adopt to medication and other surgical procedure which I have just told you. Some people, however, have found some little bit improvement with treatments such as acupuncture, biofeedback, chiropractic, and vitamin or nutritional therapy. Be sure to check with your doctor before trying an alternative treatment, because it may interact with your other treatments.